most of the services that are task shifted, they are not given the ceiling where the professional will limit their own practice. So you find that somebody from much lower cadre will now apply a skill that is only vested on somebody who is maybe a much senior doctor or even at the level of the professor in terms of services. And that is giving us problems. Instead of improving the health system, it's now giving more problem and compounding the problem. And that is why we are thinking that at the federal level, there should be a caveat whereby all the programs that they want us to tax shift, we should be given ceiling, different cadres that will apply the practice.
So somebody raised an alarm of unemployment, what do we call it, the voluntary workers in healthcare facilities, and how they were sidelined when the opportunity comes. What supplement are you going to?
Yeah, you can see voluntary workers across the facilities. That one is your own volition. If you decided that you want to take voluntary work and give contribution to your community, it's okay. But government has its own way in which it recruits staff. And recruitment of staff, it has to go through so many processes. It's just not given overnight. It has so many bureaucratic processes which you must make sure that you satisfy the condition of the civil service before you employ. And then you only employ when you have the people that will serve that area. You don't want to increase redundancy in the facilities that you have. And that is why, because we have program and structured civil service, we abide by that. Whenever we have the gap, you have to get the applicant, you have to conduct interview, they have to go series of steps for the civil service to satisfy the criteria before them. And that's why you see volunteer. And because those people, they cannot wait, and that is why they are taking volunteer. But what the government does is that once it gives you the opportunity to read, to get the certificate, it has already given you all the opportunities. You can do your own private practice, you can do a lot of things. Or if you want to do the government, then you wait for the government time when they schedule for the interview, you apply and then you get the job.
So for the NCD coordination dissemination workshop, what's the message?
The message is that many people, they don't go for check-up to know whether they are diabetic or they are hypertensive. Because of that, they found themselves having the disease. And because the diseases are so silent killers, they don't manifest easily, and that is why it takes time. People, in fact, people, they deny that they can get hypertension or diabetes. Only when they get it, they now start seeking for treatment. And